for our internal employees who we call team members. And some of those learnings that may be worth you also considering, regardless of what role or perspective you bring today. And as a note, prior to my time at TELUS, I've been here for about 5 years. I came from the consulting and service provider world in the organizational well-being space. And and I'm here today representing the employer's experience, but I'm definitely going to bring that consulting, carrier, service provider mindset to the conversation today as well. So hopefully some of this content lands with you based on those facts. So when I jump in, when I start going through my slides, I'll start with something that you're probably going to expect to see, and I'll dive right in. And you likely knew that this was coming, which is, and I'd be really remiss not to mention it, especially given the topic of well-being and mental health is top of mind today. But the pandemic has permanently shaped and changed our workplace for good. It's changed our organizational cultures, our approach to leadership, our perception of flexible work, and really so much more. And like the quote says, we feel really strongly at TELUS, and we felt this way before the pandemic, but we are really pushing the message within our leadership ranks that if we don't manage people risk into the future to an even greater extent than we've already done or that we've done before, our people will definitely suffer, which we obviously don't want to have happen. And our business and bottom line is also going to suffer too. So managing people risk really, from our opinion and from our perspective, should be a top business priority for any organization today. And I don't just mean a priority for HR, I mean for the organization really at the highest level. It should be a business priority. So with that in mind, and I'll come back and loop back a little bit to COVID in a moment and the pandemic, but I'm going to start by just talking a little bit about our approach to well-being at the organization. And thankfully, well-being was recognized as a priority at TELUS quite some time ago. We've been at this for years, but about 5 years ago, TELUS decided to come at this a little differently. And so you'll hear people often talk about creating a culture of well-being. And our CHRO, Sandy McIntosh, was really determined to actually take what was already an exceptional wellness program or something more kind of in a box, a set of activities, and build a well-being strategy that would really shift the culture. And so as a note, our well-being strategy also includes our mental health strategies. So they're tightly woven together. So you'll hear me talk about them interchangeably throughout my comments. But of course, using a design thinking approach and coming from consulting like I did, our strategy is really much more comprehensive, and it's focused on ensuring well-being is not only pervasive through resources and tools that we offer, but it's actually pervasive throughout the organization, throughout the employee experience, with a focus on things like norms, practices, leadership skill building. As opposed to just being simply a set of offerings, we wanted it to be something we think and feel every day at the organization. And that really what a culture of well-being is all about. So when we reflect on how we've been successful at actually evolving that culture to one of well-being, it's really been through these three drivers. And I'll spend a little bit of time unpacking each of them in more depth. But at a high level, we have a huge focus on infrastructure. So we want to make sure the ecosystem at the organization supports well-being at a deeper level. Of course, you can't be talking about well-being and mental health, but have practices and policies and things that don't support that type of mentality. So that's certainly a big focus for us. Organizational awareness. And so for us, this one is all about always on communication, consistent messaging, building up a network of influencers that talk about well-being within TELUS. So that's a pretty significant win for us. And I can get into more of those specifics. And then, of course, targeted programming. And this is, for us, is all about making sure the programs and resources that we choose are chosen deliberately and based on insights and data that have helped us identify the need. And so we use that data to really inform our strategy on a regular basis. So I'm just going to dive into each of them in a little more depth. I'm going to start with infrastructure. So when we turn our attention at TELUS to the critical components of our well-being strategy that really shift the culture, from TELUS's perspective, creating an ecosystem or an infrastructure, like you see here, that supports well-being and mental health is probably the single most important thing that we've been able to do and that I think organizations need to do. Because the reality is, without a really good infrastructure or a foundation, your strategy can't take root and certainly can't flourish or be sustained. And so I think for employers, any employers on the call, the good news is focusing on these types of things don't necessarily take a ton of budget. They may take some, and you may need some external help to get this off the ground. But the thing about this is it isn't easy work. This is what we affectionately on my team refer to as the grind. It's tough work. It's clearing the path where no path exists. And maybe not everyone fully understands the whys, or the whats. But this is really what shifts the culture, not initiatives. Those are helpful and they're absolutely imperative. But an ecosystem really is required to shift the culture if that's what you're looking to do. And so this slide in particular depicts some examples of infrastructure related work we've done with respect to our strategy, but in the sphere of mental health specifically. So I can share a few examples just to give you an idea and a flavor of what we've done around the infrastructure. So something like reviewing our existing organizational policies. Are they reflective of the current culture that we want to create? Do they protect things like psychological safety? Do they promote good mental health? Do they use the language of mental health and well-being? And for us specifically, we actually realized our disability management policy was not really living up to that. It wasn't protecting the psych safety of our employees, our team members, ironically. And it really wasn't doing what we wanted to do because people were at their most vulnerable and we're having to go through these really difficult gates and processes to just take some time off work. So we adjusted and provided more one-on-one support. We did things like shortening forms, removed some requirements of team members, and used more recovery and well-being language. I found as someone coming into the organization, we'd really fallen into the trap of using a lot of disability management jargon that was sometimes confusing for team members. So we softened that and made it a little more clear for them. And so the work that we did wasn't really a mental health initiative. It was policy related and process related, you could argue, but it definitely has an impact on mental health because when employees, again, are at their most vulnerable going off work, this is giving them the support they need so they can feel mentally safe in the organization. And that's what this is all about, creating that infrastructure so people should feel it every day in different ways, really no matter with how they intersect with the organization. Our group also regularly does deep analysis, data analysis to determine what segments of our business are most at risk for mental health issues. So based on things like demographic profiles, engagement scores, short-term disability trends, drug utilization again, we look at that data at least annually and then use that to target based on those needs. And then what we do is share that information with leaders. So not just our leaders within each of the business units across TELUS, and we have 30,000 employees. So we have 9 business units. So we share with those leadership teams, but we also report back to our board at TELUS. And so we do that quarterly, keeping them up to date on our progress, which really allows them to be kept up to speed, but also to continue to support and buy in because they know what's going on and they can see the impact and the success that we're experiencing. One of the other things I think from an infrastructure perspective, we were really excited about this year was we created something called the Mental Health Commitment, which was supported and signed by every member of our executive leadership team and distributed to all of our team members. And it really just serves to reinforce our commitment to creating a psychologically safe environment and to highlight the fact that as an organization, we're on a journey to align with the national standard of Canada for psychological health and safety. So best in class framework to create a psychologically safe work environment. But it also highlighted the role of team members and managers in their role in the organization and the part that they play in creating a mentally safe workplace, which was really important to us because we know it's important that everyone feels like they play a role. We offer comprehensive mental health training, as I'm sure any employers on the call today do. We offer it for leaders and team members, and we have an ongoing sustainable model. So it's not a one and done approach. It's actually, we continue to offer it through different mediums. We also continue to build out our mental health first aid network across the business. So business unit by business unit, we continue to build that. And these are just some of the things that I think that we call the behind the scenes work, but that we feel is probably the most important work of all. And I think this is something a lot of organizations overlook, is planning and building this type of infrastructure work into their plans year in and year out. We create a 3-year plan and we have what we call team member facing initiatives and we have behind the scenes related work. And it's planned for, and this work doesn't stop, and it won't stop because you constantly have to be nudging that culture and that infrastructure forward. And this is how we tackle that. Now, a big part of our infrastructure is the brand and the messaging we've created around well-being, of course. So how we talk about well-being at the organization and how frequently is really deliberate. We don't want just people in culture talking about well-being. We want everyone talking about well-being. And to make that happen, we believe people need to be able to really connect with the language. So we've kept it simple, but we have to constantly reinforce the message. And when I say constantly, we truly have well-being messaging front and center at TELUS. And I'll share a little bit more about what I mean about that in a moment. But first, I'll just share some of the key concepts you see on this slide. And this is how we discuss well-being when we're talking to our team. So this is our, our employee-facing or team member-facing language. And the first is what you would expect, a simple continuum, which is that arrow at the top of the screen. And our message to our team is that well-being flows on a continuum throughout our lives. 1 month you might be feeling well, the next month maybe you're struggling, and then when things get really rough you might start to feel unwell, but you're never static and in one place. Well-being is fluid, and certainly during the pandemic we all saw and felt this a lot quicker than normal, the movement up and down the continuum. So we use that to explain how your health can and ebb and flow throughout your life. And then below that, what we also created at TELUS is a really holistic definition of well-being at the organization. So gone are the days where you kind of just focus on, physical health and even mental health to some degree. The reality is many things contribute to how people feel. And so we use the 5 dimensions listed here to hit home that point to our team members. We chose these dimensions to kind of speak to the individual and complex nature that each individual would experience. Whatever fuels Joe's well-being could be starkly different from mine. Maybe it's his social relationships that fuel his, and maybe for me it's my financial situation. But the reality is all of our team members should see themselves in this definition. And so they reflect that individuality that's underscored by well-being. But the bonus is we were deliberate in choosing them so that they also align with our values as an organization. So they also are making connections for our business and for our leaders, but also are meaningful for our team, which I think has had a great impact. So as I mentioned, we kind of consistently and frequently use this language in our day-to-day. We spent the time up front socializing our strategy in this language with leaders, sharing this with them, asking them to use the same type of language. And I think one of the other really important things we did around, communication and building that always-on messaging is to regularly train who we call our influencers and provide them with regular updates on our strategy and our plans. So people like people and culture business partners, our leaders, our communications teams, grassroots well-being teams that exist in different business units. We really, again, wanted everyone to talk about well-being in the same way. And we wanted them thinking about it similarly so that the message could be constantly reinforced. And so that this really wasn't just an HR-led initiative. We wanted everyone talking about it. So it's super important to keep that network up to speed and constantly reminding them of our key messages, which we do. We meet with them several times a year to keep them up to date on what we're up to. And any presentation we do at TELUS starts with a quick overview of our strategic objectives, the continuum, and the 5 dimensions, to a point where people have heard it 100 times, but I can guarantee you there's 5 more that haven't heard it, or at least it hasn't stuck. So we're big believers in repeat, repeat, repeat. Traditional sort of marketing message. We keep repeating that message, and we're seeing it start to shift. We see people talking about the 5 dimensions freely. You see that language pop up in communications from people and culture. They incorporate the language in our re-enrollment information, talking about psychological well-being and financial well-being. Or if you're looking through our talent and our recruitment teams and you're looking for a job at TELUS, they'll talk about our our award-winning well-being culture, the 5 dimensions. And it's even broader than just P&C, people and culture. We now have leaders building this language into their annual plans. Leaders hosting full days of well-being events for their teams. And if you're following a leader from TELUS or a member of our executive leadership team on LinkedIn or really on any social channel, you'll see it show up there as well. So this to me is indicative of a culture that is shifting, is when you have people talking about well-being all over the place. And that was really the goal. And we're starting to see that. And we've been seeing it for a few years now. And so our last driver that I wanted to highlight is really on how we target programming. And so first, as I mentioned, we use both of these concepts, the continuum and the dimensions, to communicate a wide range of messages to our team members. But we also use it when we're evaluating what we want to implement and the products and services we want to offer our team. And so we ask ourselves questions like, do we have products that support all stops along the continuum? Are the number of products relatively balanced throughout the continuum? Do we have resources that support all 5 dimensions? And I think that the simple kind of process allows us to always tie our choices back to our strategy in a really simple way, while making sure there's something to support as many issues as possible and meet our employees where they're at. So specifically on this slide, I've highlighted some of the mental health tools and resources that we have available at TELUS. And you can see that we've selected the products across the continuum, like I mentioned. And as a result, we've created a really comprehensive support system. And I'm not going to take you through every option one by one, because I think you can see the approach outlined. But you'll notice things like we have an EFAP program, which is an excellent resource, and it's one tool in our toolkit. But we also have a number of other supports, like increased coverage for psychology benefits, which sits at 5,000 per team member and eligible dependent. We have virtual care. We have comprehensive mental health training. We launched the Calm app for team members. Again, selecting initiatives and resources to meet people where they're at on that continuum and using a variety of mediums. So the support really becomes as broad as it possibly can. And so that's really our goal and how we use this really functionally day to day. And the other thing I'll say about targeting our programming is we also extensively rely on data to inform our strategy. So we establish the typical benchmarks at the outset of our strategy, looking at benefits related data, drug information, workers' comp, disability, all of those things. But we also looked at things like our engagement survey results, turnover rates, and introduced early a value on investment conversation, not a return on investment conversation. So that VOI approach, though it does include, if there are financial impacts or outcomes like a traditional ROI approach, it does include that, but it also includes a lot of other things like satisfaction rates and changes in our behavior, participation rates, improvements in maybe health risk factors, and also includes things like how our strategy actually helps improve the story we can tell about TELUS externally to clients and employees, and use it as a recruitment tool as well. And trust me, that really has value. And so that value on investment approach has been really key to our success and having our leaders buy into the fact that that's how we measure that we're doing a good job here. We also segment our population. So because our organization is so big, we at a minimum will look at a business unit level when we're looking at data. But then within that, as you can imagine, in some business units, you might have a lot of different work being done, whether that's a technician and a contact center team member and an office worker team member, all very different roles. And we think that role plays into the health risk as well. So we actually segment our data based on what we call personas, which you've heard of, obviously, based on those unique characteristics that exist between the type of role that exists at TELUS as well. So the risk profile can be very different, as you can imagine, between a contact center employee, for instance, and a technician. And so we want to make sure we're looking at that level of data because it allows us to just create an even more targeted approach and really drive the outcomes that we're looking for. So the comprehensive nature of those three things is what we feel sets our strategy apart. It's set us up for success. And you might be kind of wondering, like, well, how do you know you're shifting the culture? I've mentioned a few things throughout. We've seen leaders being more vocal around integrating well-being into the regular practices. We held mental health training that was voluntary for leaders, and we had 90% of our leaders take it in 3 months' time. So for us, just at TELUS, that's just shy of 3,000 people. Before the pandemic, in the first 3 years of our comprehensive approach that I described today, we actually saw our short-term disability rate for mental health claims drop 8% after increasing steadily year over year prior to that 3-year window. We've seen our engagement scores go up related to how our team members perceive TELUS's support of their well-being, and it's up over 90% at this point and has been consistently for several years. And we've also recently just tied well-being related behaviors to our performance review processes. So leaders and team members now are going to be assessed. Their annual performance will be assessed with consideration being given to how much they support their own well-being and the well-being of others. So it's a pretty big win for a big organization like ours and pretty progressive. So we definitely have more to do. There's always more that we're looking to nudge forward, but we've come a really long way for an organization that was already doing a really great job. So I'm going to turn my attention just for the last bit of my presentation on, what is top of mind for us now as an employer. So I talked about what we've been up to. What's top of mind for us now? And it's definitely evolved based on the pandemic, and as mentioned in my opening comments. And I mentioned people risks or business risks. And when you think of the continuum I spoke about earlier, where we have people on the spectrum of well, struggling, and unwell, each of those categories themselves have been impacted. So each organization used to have a lot more people in that well category, but the people in the well category right now are just kind of feeling well enough at this point. They're not 100%. In fact, I think there was a study from Angus Reid and the CBC that said 54% of Canadians said their mental health had worsened during the past 2 years. So before you had in an organization a much larger contingent of employees that were in the well camp, but than you have today. And the complexity of issues as you move kind of left to right on this slide is growing and becoming more challenging. And all employers, I think, really need to understand that more people in your employee base are struggling. Whether you kind of believe it or not, that's the case. And they're struggling, and you can see the image of the man fading. That's what's happening to employees. They're fading out a little bit. And below those images, what you'll notice are the business threats that come along with that. And these are threats to our business that come with people risk. So if we fail to address the people risks, our business is going to suffer in some way, as are our people. So the question for us is, rather than experience things like, higher presenteeism and turnover rates, increased chronic health issues, more short-term disability issues, increased benefit costs, missing sales targets and business targets because people just aren't feeling themselves. What are we going to do? What's the step? Is the step to reply and respond to the outcome, which is listed in bullet point on this slide, or do we collectively want to go further upstream and try and avoid the outcome in the first place by being more preventative and more well-being focused and focusing on things like mental health? And that for us is really important because we want to avoid these threats to our business as quickly as we can rather than deal with them as outcomes. And so with that, the top of mind concerns for us, how does this all translate? More people aren't doing well. We know that. And we know the after effects of COVID are here for years to come. So what does that mean for all of our collective strategies or for your client strategies? These are some of the things that are top of mind for us that I thought I would share just so you can see where we're at. And we've already addressed the first bullet on the previous slide to some degree, but every level of the organization, again, is struggling, even if they say they aren't. So we can't assume everything is fine, and we have to do something different. The way we thought about well-being and did things previously has changed, and that leader level, they're struggling too. So those leaders, including your most senior leaders, have taken on more than any group in the organization has over the last couple of years, all the while doing their own demanding job. And so they're less likely, that group generally, to put their hand up for help. So trying to find ways to support that group, given it's kind of difficult to pin them down, is really important. Turnover, we hear about it all the time. More people are leaving organizations. And though the numbers in Canada aren't quite great resignation levels, and we're starting to see them normalize to some degree, there's still a concern for employers, at least in the short term, and it is a concern for us as well. So determining why people are leaving is really crucial. And we know that people now more than ever want a role with purpose. They want flexibility. They want an organization that cares about their well-being. And they're prioritizing those things much higher than ever before. In fact, they're coming in at the first and second reasons why people are leaving or choosing a new employer. So if organizations don't take that seriously, people looking for jobs will just find an organization that does, because there's going to be someone else out there. So that's going to perpetuate that turnover situation. Another challenge most of us will face is the reality that more people are going to be working out of their homes, right? So running certain well-being initiatives like we used to, like cardiovascular clinics, that's going to have to change dramatically. Also, just determining how we protect psychological safety has become harder because the work environment is now the home environment. And so we have less control over that space. And so those factors are really changing and evolving, and we're going to have to collectively get our heads around how we manage those risks. And it's a bit of a question mark for all of us. We're working through it, but I think it's something employers really need to grapple with, is how do we handle that new workplace? And how do we, when we have a little less control over that environment, how do we get to that workplace in a different way now that people are spending most of their time there? As I mentioned, leaders need our support for their own well-being. As I mentioned, they're struggling, but also the way they lead has changed, and the way they're going to need to lead has changed. It's evolved, and so humanistic leadership is going to be front and center. Organizations will need to place a lot more emphasis on how to train for those new set of skills, and those new set of skills are around protecting things like psychological safety, promoting well-being, prioritizing diversity, inclusiveness, and equity. And you also need to think about leaders that can ignite purpose and passion in their teams, because that is what team members are looking for. So getting our leaders in that headspace and preparing them for that is really important. And lastly, and certainly not a small beast to tackle, is related to mental health issues in the workplace, and issues that are increasingly becoming more complex. And we see it a lot right now, complex mental health issues coming through our short-term disability chains and other places. And with wait times and access being such a significant problem, even before the pandemic, and with increased levels of chronic stress en masse, more employees off due to mental health issues, especially connected to the pandemic, how are we going to tackle this in the future with a system that's already really struggling? And I think the emphasis and weight is going to be placed on employers more squarely. They're going to be asked to find new and more impactful ways to support employees. And how are we all going to do this? So these are the issues and questions we're working through. They're not small things to tackle, but we're up for the challenge and think that we're on the right path. And I think asking ourselves right now how we can attack this is really key, and getting in front of these things is important. And we've been talking about this for a couple of years now, and I know Michelle and Diane will talk about this in a few other comments. But it's going to require creativity, innovation, and a commitment to the ongoing, evolving nature of well-being. We have to take a hard look at who we want to be as organizations. And if you're a consultant or a carrier or someone on the phone, your clients should be asking themselves these questions. Who do we want to be in the future? And it's not the same as who we were in 2019. It's something different. And so with that, I'm going to pass the baton to Diane to help dig into the complex mental health issue a little bit more. Over to you, Diane.
There we go. Okay, I'm a psychiatrist. Before I went to medical school, I got my pharmacy degree and worked as a pharmacist while I was training to become a doctor. And most of you know that psychiatrists treat patients who have very serious mental illness. And my particular area of expertise, because of my pharmacy background, is in psychopharmacology, or using medications safely and appropriately. Of course, there are all kinds of other treatments that are important in the management of a mental illness and helping people to recover from mental illness. So I'm here to provide a physician perspective regarding the future of employee mental health and well-being. So jumping on where Janet left off. Oh, I thought I was on that slide already, so I'm just going to forward here. So we often use the terms mental health and mental illness interchangeably, but they're really not the same thing. The World Health Organization has given us this definition. I think it was back in 2004 or 5, but it's really stood the test of time. It's a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her own community. So you can see work is right there in the definition. Your ability to be effective and productive in your usual roles at work, at home, at school, wherever you are and whatever you're doing. So just like your physical health, we all have mental health ups and downs. If you're feeling a little bit stressed, there's an upcoming event, you're not sleeping quite as well, your mental health doesn't feel optimal. Just like if you had a sore throat, your physical health would feel a little bit off. Mental illnesses are more than just a few grumpy days or a couple of sleepless nights, though. Mental illnesses are medical illnesses, and they impact how you think, how you feel, how you behave, and they all impair every mental illness diagnosis. It includes functional impairment, your ability to function in your usual roles. So in any given year, 1 in 5 Canadians will personally experience symptoms of a mental illness. 1 in 12 will have a diagnosed substance abuse disorder or diagnosable, and 1 in 24 will have a serious mental illness. So while not everyone has, we all have mental health, but not everyone has a mental illness, all of us are affected or impacted by mental illness because so many people do. So whether it's a friend, a loved one, someone you work with, people we care about who are living with a mental illness, they're not functioning optimally, we're affected. And sometimes, especially if it's someone who's very close, very important to you, we can be very significantly impacted. Now, I mentioned the ups and downs of mental and physical health, and sometimes it's better reflected on this spectrum. And when I met Janet, she had a spectrum and I had a spectrum, and there's a lot of overlap between the two. This is how I represent mine. So I have to say, of course, there are lots of reasons why people develop a mental illness. So this is really simplifying the story, but I find it helpful because stress in life really is an important risk factor for mental illness. So sometimes we're feeling really healthy, but then we're hit with stress. We're under a great deal of pressure, and there's all kinds of different reasons. And that stress can have important impacts. And if it goes unchecked, it can go on to affect our functioning, and in some cases, ultimately lead to a diagnosis of a mental illness. Now, it's important, Janet's words, which are people risks are business risks. And in the workplace, if a team member is experiencing challenges with their mental health, if their mental health is moving towards the right side of the spectrum, it can manifest in many different ways. So of course, healthy employees, they are the bedrock of our organizations. They build effective teams, they're supportive, engaged colleagues, they deliver on their work expectations. However, it's inevitable that we're all going to face stress at some time, and it could be from many possible sources. And without the appropriate support, that stress can manifest negatively. It can impact your work performance and also undermine your confidence, your abilities. When you feel less effective, that can make you less effective. Without intervention, what starts out as stress can then lead on to something that's chronic and disabling. It can actually lead to functional impairment. And remember, functional impairment is, again, not just the inability to deliver on a product or a project. It actually can cause major disruptions in collegial relationships. And also pointing out that presenteeism, you're at work, but your brain isn't. You're there, but you can't perform optimally. This is actually much more common and far more costly to employers than absenteeism, not being there at all. And then finally, some people will ultimately be diagnosed with a mental illness. And while the majority of people who have had a mental illness are employed and they function effectively, when symptoms of a mental illness are acute or severe, an individual may not be able to function at work and lead to short or long-term disability. So this is why employers like TELUS make such an effort to have interventions available across this whole spectrum. So it may seem odd if you look under healthy there, why would you need to intervene when someone's healthy? And really the reasons underlying this are to maintain health. Just like our physical health needs maintenance, our mental health also requires maintenance. So by providing tools that help to better manage stress, like mindfulness, meditation, education around the benefits of eating a healthy diet. A Mediterranean diet actually fuels your healthy gut biome. Exercise, a good news story, 30 minutes a day, mild to moderate intensity is actually a treatment for depression and anxiety. All of these help to maintain team members' health. And of course, providing a psychologically safe workplace, which Janet just showed you, she works every day to do, and Michelle's organization also helps to create. It's a critical tool in maintaining mental health and keeping people at work. Sometimes if you're ill with modified hours, or getting them back to work as quickly as possible. So of course, every step along that spectrum, there are different, and as you move to the right, perhaps more intense possible interventions, including talk therapy and sometimes medication. Now, unfortunately, mental health claims we know are the leading cause of disability in Canada, and this troubling trend is only going to worsen. In fact, the pandemic has increased the velocity of mental illness claims, and it's believed that more than 50 million additional claims for depression alone worldwide have come from the impact of COVID-19. So despite all of the investments in employer mental health, too many people still end up on disability. And once that happens, they also often have a very long journey back to health, and some never make it back to work. The statistics are jarring. So I really hope to be able to show you a little video here that we had created with some of the challenges within the mental health care system, what patients are facing, and also some solutions, but we didn't get it done on time. So I'm going to show you some stills and look forward to sharing with you the final product very soon. So I want to make the point, and I'll make it again and again, every brain is unique as each individual. And it's why mental health care needs to be personalized to meet each individual's needs. And that is not happening. When you're living with a mental illness, and many of you who are listening right now are living with a mental illness, especially when it's acute, when it's severe, you feel very alone. And those who support and love them also suffer along with you. So I don't just care for the person, I have to care for everyone in their circle. Now, there are lots of reasons why people have trouble getting the right care for their mental illness. And one of them is the fact that when you have a mental illness, even the most simple activities can seem difficult or even impossible. And sometimes you need a nudge from someone who cares just to get out that door. The shower, having a shower can feel like a Kilimanjaro. It's just too far to go. So organizing yourself to get help sometimes can feel impossible. Now, consulting with a primary care provider, and that includes family doctors and increasingly nurse practitioners, that's the right place to start when you're looking for help. In fact, most people never see a psychiatrist at all. And if they want to see one, they can't access one. And of course, primary care providers are really trained to see the whole person, not just one part. They know when to ask for help, and they do the majority of diagnosis and also treatment. But remember that treatment and making the diagnosis and treatment, these are difficult things to do, even for psychiatrists. And we know that more than 50% of initial psychiatric diagnosis are not accurate. That is a huge barrier for a patient to recover from. Now, one of the major reasons for misdiagnosis is the fact that mental illnesses are complex, and we don't have lab tests, we don't have x-rays to confirm a diagnosis. And of course, once the diagnosis isn't correct, everything that follows can't be optimal. We do, however, have validated frameworks like the DSM-5, the ICD-10, and also measurement tools called clinical scales. And these tools help healthcare professionals to make sure you have the right diagnosis. And when the diagnosis is right, of course, you're more likely to start on the right treatment and get better faster. Of course, we cannot fix everything that's wrong with the mental health care system at once, but helping to improve access to high quality psychiatric guidance is important. It's critical, and it's actually viable first step. So this is what I'm working on, is an innovative, science-based, accessible tool to put in the clinicians' hands, those frontline primary care workers, that will improve the speed and the accuracy of a psychiatric diagnosis, which of course helps to get the patient on the road to effective treatment and recovery sooner. Get them back to work, back to life, back to love. Now, primary care practitioners bear the weight of mental health care in this country. Probably 80 or 85% of all psychiatry is done by family doctors, nurse practitioners. So we need to support them with better tools, which will help to lift that weight and gives them the opportunity to offer more effective care and also more compassionate care. Compassion should be at the heart of healthcare. It's missing. And so I believe that I need to have compassion both for my patients and also for myself. Now, I know that improving access to mental health care is not going to come by hiring more people like me or creating more people like me, more psychiatrists. It's just not possible for a whole bunch of reasons. There's just never going to be enough. And in fact, in British Columbia right now, about 30% of British Columbians do not have a family doctor. So adding a few more psychiatrists is not going to have an impact on the massive number of people who need psychiatric guidance right now. So my epiphany has been that we need to focus our support on primary care providers, lift them up. That will truly have an impact on our mental health care system and on human beings who need us. There we go. So in summary, in my quick little chat, employees or employers play an absolutely pivotal role in mental health care. 1 in 5 of us will experience every year, within a given year, symptoms of a mental illness. More than half will be misdiagnosed if they go for a diagnosis at all. So there's clearly a pressing need to improve the accuracy of a psychiatric diagnosis and the effectiveness of treatment plans. That's the way we keep people at work, get them back to work, help them in all of their areas of functioning. There's lots of reasons and impacts of the pandemic on the workplace, as Janet talked about, but also in healthcare. The pandemic has really forced us to focus more on the healthcare and the well-being of our teammates. It's more than ever, I am focused on trying to change this path, this trajectory that we have by harnessing technology to support the delivery of quality guidance for primary care providers. So we're on our way. Watch this space. I'm happy to share more very, very soon. And now I'm going to pass it over to Michelle.
Thank you for that. What an inspiring occasion to learn from Janet about the efforts at TELUS to create a psychologically safe workplace. And the same with Diane in terms of how to remain resilient at work, how to ensure that we look and consider the mental health continuum. So it is really a treat for me to share the virtual stage with Janet and Diane. And thank you at TELUS for inviting me to participate today. As you've heard from both Janet and Diane, the pandemic has noticeably altered the mental health landscape in Canada. Amongst these changes are the gaps in access to adequate, appropriate mental health and substance use care, which has grown dangerously wide. Some groups have been disproportionately affected by the pandemic, and those are individuals who are young and who have young families. Some groups are actually experiencing a mental health problem for the very first time. So undoubtedly, many of us are talking about a parallel pandemic of mental health problems, illnesses, and substance use. At every level, we have to acknowledge that the growing divide between where people are and where they want to be on their mental health is really growing. But we can build bridges and close these gaps. COVID-19 has been a wonderful catalyst in some ways for rapid change and innovations in care, virtual care, e-mental health, the use of EI. And there also has been an impetus for more investment in mental health and a deep collaboration between public and private providers. And that's what I'm going to be focusing my talk on today. Oops, my apologies, I'm having problems with. But let me start with a story about a service user, and we'll call him Ben. Ben has grown increasingly anxious throughout the pandemic, disrupting his concentration of work and making it difficult for him to sleep day after day after day. He had access or has access to mental health benefits and is really fortunate to have an EAP through his employer. But like many, Ben wasn't sure how to get started. And since he had a family doctor, he went to his family doctor instead. After some initial consultation, his doctor referred him to a few local psychologists. As you know, those services are not covered by the Canada Health Plan. So all of them had fees between $150 and $200 an hour and wait list upwards of 3 months. He put his name on a wait list and decided to try his EAP. The sessions were helpful, but with only 5 included in his coverage, he had to stop the sessions just when he was seeing some progress. He had a similar experience with the handful of free consulting sessions and resources offered through Wellness Together Canada portal. Helpful, but not enough. By the time he finally saw his psychologist and he had to provide the same background information for the 4th time, he was feeling discouraged. He knew that just like any other service, he was on a clock. His coverage wouldn't last, and paying out of pocket was simply not an option for him. Over this period, I'd like you to notice that none of the providers spoke to one another or to Ben's family physician. In the end, Ben told his family that he felt like he was pretty much back to where he started at the beginning of the process. His family even offered to pool their resources to try to pay for additional sessions. But Ben declined, saying he was tired of dealing with all of it. In his words, "I don't know who this system is built for, but it doesn't work for people like me." So as you have seen there are many issues with the pathway that Ben had to go and many missteps in his process. And as Diane identified, this is all occurring when you're feeling pretty vulnerable And as she indicated, getting to the shower is like really going up a mountain. So as you know, private sector plays a significant role in mental health services to Canadians, and that role is actually growing. EAPs and employment-based benefits have particularly important roles in Canada, where 70% of the population has some form of private coverage. By comparison, in the UK, it is 17%. In 2020, it paid out 420 million in psychological service claims. That was up 24% from 2019. So data sets that are congruent with what Janet and Diane shared. We did some polling every 2 months since the beginning of the pandemic through Leger. And we found that overall, anxiety went up at the beginning of the pandemic and has remained high throughout the pandemic. And some groups have faced even greater mental health impacts. As you can see in the chart here, 1 in 4 Canadians report moderate to severe anxiety, but that is even higher for women with young children, for youth, and for low-income families. So let's unpack this busy slide. Oops. We held a forum of key players in healthcare, business, government, and private insurance to identify shared priorities and for really establishing some collaboration. Opening speakers provided their own personal examples and perspectives, some lived experience of a mental health problem or illness, or a substance misuse issue. When we looked at all of these, there was a lot of discussions around insufficient resources and in some case, inefficient use of resources. Health systems and service providers have responded to increased demands for mental health services with significant investments, but still, this is not enough. Many employers are interested in expanding the mental health and substance use health supports they offer to their employees, especially given increased employee demand for and use of existing supports throughout the pandemic. Yet, with 90% of Canadian workforce employed by small and medium-sized employee enterprises, it's really difficult to strike a balance between meeting employees' needs and overburdening companies with very limited resources. Another common theme was equitable access. The lack of full public coverage for mental health has resulted in a two-tiered system. This often leaves people from lower income or rural communities or communities that have been marginalized, unable to access care. In many cases, due to the narrow criteria for eligibility, covering only services delivered by a physician or within the public health system. In other cases, the constraints are mostly physical, with services largely unavailable outside of large urban centers. The pandemic has also affected access, with job losses creating a transitional workforce not eligible for employee-sponsored insurance plans. This is especially true for women who were overrepresented in the hardest hit industries early on in the pandemic, such as retail and hospitality. And not surprisingly, long wait times was identified as another common barriers between private and public care. In some cases, wait lists have become so long that services may actually be considered effectively inaccessible, especially to those with specific needs or who do not have a private plan. Another key area of focus has been the complex navigation between public and private systems. Like in Ben's experience, the current mix of public and private insurance results in a lack of consistency in covered services and requires people to transition between service and providers throughout their health journey. Even if these transitions were smooth or well coordinated, people would still have to repeatedly tell the same story and reestablish trust with a new provider. Not only is this a frustrating experience, it can add to their trauma when they are feeling particularly vulnerable. As Diane discussed, family physicians play a critical role in knitting together physical health care with care for mental health and substance use health. Participants at the forum asked, how can we better equip primary care providers to help people and families as they navigate the mix of public and private services? One way is to better integration of primary care with specialized services. Another theme that emerged from the importance of comprehensive data. Every point of interactions with the healthcare system generates data that, taken together, could provide a comprehensive picture of the system, its users, service effectiveness, health outcomes, and gaps to be filled. However, this data resides in many different places, collected by different organizations for different use. And one of the largest hurdle remains privacy. Sharing data requires massive efforts to ensure privacy is protected, and data is not misused. Another way to enhance service is through outcomes-based care. As you heard me describe with the example for Ben, most coverage for services, whether public or private, is measured in terms of time or number of sessions without taking outcomes into account. This often results in people stopping treatment when they reach their allotted maximum in terms of sessions, whether or not they've reached the recovery they had hoped for. Last year, the MHCC staff that publishes our newsletter interviewed Donna Richards, a social worker who also works as a counselor for an EAP. She believes wholeheartedly in the services she provides, but she was also quick to note that in her experience, they rarely go far enough. When she gets to the end of her journey with a client, it's not because they have recovered or they're ready. Rather, it's because the allotted coverage has simply run out, regardless of progress. To be effective and ensure people get the services they need, there's an opportunity to develop common metrics to assess outcomes and efficacy. Once in place, coverage could be based on those metrics. Before unpacking priorities for emerging sessions, I'd like to maybe unpack a recent report. So it's a study that we did in collaboration with the Canadian Psychological Association that interviewed employees and employers. And in many ways, it mirrors the information we shared with you already. Among the employees surveyed, 80% feel that their mental health benefits are inadequate. Yet on the other side of the equation, only 29% of employers surveyed report having increased their coverage. To learn more about these findings, you're welcome to follow the QR code and you'll be taken to the study itself. At the end of the day, a consensus emerged at the Public-Private Insurers Forum. First, the need to advance collaboration. The second, around the top 3 priorities for collaboration going forward. The first, increase capacity, including in primary care, to strengthen mental health and substance use services delivery across sectors. Then improving service navigation. Make it easier for people to seamlessly transition between publicly and privately covered services. Lastly, data collection. Finding new ways to share critical, insightful data between public and private providers to improve service offering and ensure people are getting the right kind of care. Before I reveal which of these were prioritized, let's look to the right of your screen. There is a poll, and I'd like you to fill out the poll and let us know in terms of, do you feel that data collection, improving service navigation, or increasing capacity should be the priority for this next steps of the forum? These are incredibly interesting results, a little different from the participants at the public-private insurance forum. Let me give you an example. In the case of the public-private insurance forum participants, really sharing data was ranked among the top priority. And that is true of most participants. People felt that we really needed to start sharing and accessing data from both sectors to provide a clearer picture of which practitioners are in the space, what kind of services are they offering, and what kind of interventions they're doing, primarily with what kind of populations. So really, they focused on addressing in a coordinating, holistic way all facets of health systems and service providers. There was certainly a realization that it's a complex issue and that there is a privacy concern, but it was clear at the forum that we have to treat privacy challenges as a very solvable problem. Next priority for the group was collaborating to strengthen capacity. And really there, people were orienting the work towards the needs of the individuals, the patients, and their families. As Janet explained, many employees are shifting towards workplaces that prioritize psychological safety and offer benefits that support mental health and well-being. It has now become a differentiator between employers, from one employer to the other. Strengthening service capacity will help employers to offer the kind of support employee needs and are rightly looking for. And thirdly, improving collaboration and continuity of service. The current system requires clients to switch providers depending on who pays. So where is the coverage coming from? That's simply not sustainable long-term. It adds a burden to their health journey. This burden is exacerbated by the fact that mental health services are fragmented. Service providers themselves often do not have the full grasp of services available and how the pieces intersect, which limits their ability to offer guidance as people navigate among multiple providers and systems. As a result, they're left to navigate the system on their own, supports from their family and friends, which often proves challenging, just too much effort, and it leaves them without access to services. Improving coordination and integrating data and referral systems would make transitions easier and even unnecessary, so people could receive continuous, consistent support through their health journey, regardless of whether the services are public or privately insured. By working together, the public and private sectors could raise awareness and co-develop navigation tools, not just for people who are piecing together services, but for service providers themselves. The forum concluded with an agreement on the need for further collaboration, on the need to act rapidly. There was a resounding agreement that now the time is for action. I am hopeful that we can leverage the insights from that forum and continue with conversations that we're doing today. For mental health and substance use care to work well, it has to work for everyone, from service users to providers to everyone in between. By fostering greater collaboration, we can show people like Ben that timely, appropriate, quality mental health care isn't only for the few, but for the many. Merci. Thank you. And now it is really my pleasure to turn things over to Jennifer Harrison for the Q&A session.
Thank you, Michelle and Janet and Diane. My name is Jennifer Harrison, and I am Manager of Communications for TELUS Health, and I am pleased to be facilitating the Q&A today. As a reminder to our audience, you can use the Q&A function on the event platform to ask your questions. And with that, we've already had a few come in, so let's get started. Janet, the first one is for you. And you touched a little bit on this topic, but thinking about threats to the business, have you been able to use the so-called Great Resignation as an impetus for change with regard to employee well-being?
Yeah, it is a great question. And I know I did mention it because we haven't really seen in Canada the Great Resignation levels, but for sure we have talked about it as a threat to the business, which I mentioned several times. As one of many threats to the business resulting from the pandemic, and a typical threat that exists in any business, but certainly has been exacerbated. So we've spent time talking about things like turnover and other pandemic related issues, speaking about them with business partners and leadership teams. And I think what we've tried to do is kind of switch the conversation right away from well-being as a nice to have, but rather a business imperative. So for leaders to kind of get them to listen in a different way, we've been focusing on their success, how not managing these risks could actually impact on their success and our success as an organization. And that's really been the impetus for change that I think has been successful. So having just super practical conversations with the leader at the VP level and trying to bring that risk to life, right? So if you were to lose 2 key people off your team today, how would that impact your success as a team this year? And then kind of flipping that on its head and saying, wouldn't it be better to determine the root of why they may be leaving and supporting them as much as we can and looking after their well-being and psychological safety while they're still here before they leave? And I think, though that's intuitive and these are really smart people, I do think that flip of conversation and talking about these things more from a threat perspective and a business impact perspective has been the nudge that we needed. And we already had really smart leaders doing really great things, but this has just pushed them even further to look for ways to really dig in and support differently. So yeah, I think that's been probably how we've leveraged that type of conversation, Jen.
Thanks, Janet. The next question is for Diane. You mentioned in your presentation that up to 50% of mental illnesses go misdiagnosed. This seems like a very high number. Can you put some context around that for us, please?
Absolutely. And I know I'm unmuted, so hopefully everyone can hear me. Actually, that 50% is very conservative. I've unearthed a lot of different data sets. There's one study of more than 800 primary care patients. They found that 70% of major depression was misdiagnosed, 92% of bipolar was initially misdiagnosed, 85% of panic disorder. So I put 50% to be a little bit conservative. The numbers are more than that. And there's a lot of different reasons. One is the fact that in order to have an accurate diagnosis, you need a really careful clinical and personal history, as well as talking to loved ones. So getting a collateral history, that takes time. Family doctors don't have time. Most assessments occur in under 10 minutes. Psychiatric diagnosis can be very complex. There's a high level of comorbidity, which means that most disorders never arrive on their own. Someone who has depression also has anxiety, also has insomnia, also has physical health issues that need to be considered. There's a lot of symptom overlap between different disorders, and symptoms change over time. A good example with bipolar, where you have symptoms where your mood could be high with mania or hypomania, you could be depressed, or you could have mixed features, which means the high and the low occur simultaneously. We have inadequate psychiatric training in medical school. Clinicians too often fail to review the diagnostic criteria and use the clinical measurement tools. And lastly, I'd say we have a massive issue with clinician burnout. It was already a problem. So there was a CMA, Canadian Medical Association survey that was done in 2017 that found that about 30% of physicians were already having a very high level of burnout. They just did one in 2021. It went from 30% to 53%. So there are lots of reasons why we're having challenges with getting the right diagnosis.
Thanks, Diane. Over to you, Michelle. From your perspective over the last couple of years, do you think the extra spotlight on mental health during the pandemic has reduced some of the stigma around mental health and encouraged more people to seek support?
In some ways, yes, and in others, no. So yes, the pandemic has shone a light and a bright light on mental health or mental illnesses. It has been the topic of public discourse during election campaigns, and there have been great commitments to invest additional dollars in mental health. The issue is that on the other side of the coin, stigma remains a barrier to accessing services. So unpacking that a little bit, there's social stigma, how people perceive you if you are unwell. There's self-stigma, so how you internalize this and how you see yourself, and that often impedes you from accessing services. And then there's structural stigma. It's those budgets, those policies, those procedures that people use to make decisions that are biased against adding mental health services. So all of those taken together remain very much in place. There has been some great improvements, but the pandemic certainly has shone a light that we need to take action. And hopefully from the three of us today, your takeaway is that we need to take action now.
Could I just follow up on that? Because Michelle, I liked what you had to say, just to add one little piece to that stigma. And this was a difficult thing for me to get my brain around when I first thought about it. Stigma lives in medicine. And in fact, stigma lives in psychiatry. So you imagine you've trained to be a psychiatrist to help to care for people who are living with a serious mental illness, and then recognizing the depth of stigma within your own profession. And one of the things that has driven this is the fact, and my little video shows, that we don't have objective tests. We don't have blood work that you can do and say, okay, you have bipolar number 7, and that means that lithium is the right choice. We don't have X-rays or MRIs, any kind of radiological evidence that supports a diagnosis. And so that has undermined our credibility as a specialty forever. Now we have incredible, robust data. We know mental illnesses are medical illnesses. Many of them are rooted in inflammation. But despite that, because of this history of stigma within medicine, we remain terribly under-resourced, and that continues to be a major factor in people being able to access care when they need it.
Thanks, Diane. And maybe I will go to you with the next question, because it's a nice carryover. You mentioned we don't have simple tools to diagnose mental illness, but one of our participants commented on how pharmacogenetic testing has helped reduce the trial and error approach of finding the right medications earlier on in the process. Can you speak a bit about that? And are there any guidelines to help find the right mental health practitioner once we know a patient's unique circumstances?
That's a kind of a big question, but I'll try to answer it really quickly. So pharmacogenetics is an important and valuable tool in a specific situation, but it isn't a valuable tool right out of the gate generally. I mean, if everyone had the money and the access to have pharmacogenetics, it could help to drive first choices. I think that most of my colleagues across the country would say that it is not worth the investment initially, but certainly down the road, I have had a lot of value from patients who have been able to afford to have their pharmacogenetics done. I think it is really a tool. And I hope by the program that I'm developing that we will be able to integrate pharmacogenetics so that all of the organizations that have really invested heavily in this opportunity would actually be able to realize its full value. I think our problem within mental health is so much, mental health care is so much more weighty than just having pharmacogenetics as one little piece. The greatest challenge we have is not getting the right diagnosis early. Remember, most serious mental illnesses start in the teen years. Bipolar is one of the highest rates of failure to have the proper diagnosis. And it's not uncommon for me to see people in their 50s, 60s, 70s and make that first bipolar diagnosis. And they started when they were 15, 18, 20 years old with symptoms. So there's much more to this story than pharmacogenetics, although I do see its value. The part two of that was, Jen?
Once we do understand a patient's unique circumstances, are there any guidelines to help them find the right mental health practitioner?
There's a lot to that question, which is why I made the point that a family doctor, a nurse practitioner, and even if you don't have your own family doctor or nurse practitioner and you're accessing virtual care, a good family doctor or nurse practitioner can help to figure out how severe is this, basically do a triage and determine where are you on that spectrum and help to evaluate the level of care you require. So they should be and they do bear the weight of psychiatric care in this country, but also know that people are on that spectrum and can help to drive you towards the right level of care. I do want to make one final point that talk therapy is a powerful therapy, very important for so many people, but your brain has to be well enough to learn, to hold on to new information, to learn new information. So if you're really, really sick, the value of cognitive behavioral therapy is less than sometimes you require medication to get to that point where you're actually able to utilize those skills and work effectively with a therapist.
Thanks, Diane. The next question is for Janet. TELUS clearly has a lot of resources and as a large company to support the mental health and wellness culture you spoke about. Smaller companies and organizations obviously do not have a ton of resources. Can you share some suggestions for how these companies and organizations could start addressing well-being culture in their own teams? And is this something that TELUS would possibly support a program for smaller companies to help get something stood up?
Yeah, that's a great question. Yeah, it is difficult for smaller organizations. And as I mentioned, I came from the carrier and the consulting side prior to my time at TELUS. So I definitely had a number of smaller organizations. And I think for those groups, it's starting somewhere. So the foundational elements I talked about, building that infrastructure, that can happen regardless of what size of organization you have today. So looking around, is our organization healthy? Is the way that we interact appropriate? Are there processes and policies we have in place? Are they supporting good psychological safety? Do our leaders know what to do if people are struggling? Asking yourself those questions around infrastructure, I think is a really good place to start because it is required to shift the culture. So I would start there, and that can happen regardless of size of organization. You can do that. You can look at your data as well if you're a small organization. Request it from your carrier, request it from your providers that you work with, whatever data they have, take a look at it, see what you can learn about that and try and focus your initiatives based on those health risks you see emerging through the data. So those are things that you can do to kind of lay the groundwork. And then as far as resourcing goes, it is trickier, but I think a lot of organizations I previously worked with would often turn to resources in the community, like public health is a great resource that you can get a lot of information from. They do free webinars, they offer free products and services to organizations in the well-being space, and they're doing that more and more. Reaching out to those type of providers, even talking to your existing providers and seeing if there's additional things that they offer that you may not be aware of. So if you're partnered with a carrier, then ask them a few questions. There's likely some resources there that you may not even know they offer that they can offer at free or very low cost if you can leverage in the right way in your own organization. So I think that's some of the ways you can start, but it's certainly a challenge when you're a bit more restricted budget-wise. And I'm still restricted budget-wise too, but we are a large organization with lots of great resources and a lot of in-house expertise and tools and resources too that we've been able to leverage, which has made it great for us. And I think the second part to that question was, would we support smaller organizations? And if the question is like someone like myself, like if we could have a conversation with another employer about what they could do, I'd be happy to do that. If someone wanted to reach out and have a conversation to, to kind of pick our brain and we could share ideas and concepts, and then I would certainly be happy to do that. I know on the TELUS Health side, they also have a number of people that can talk to you about a whole bunch of different things that TELUS Health is doing and products and services that they're offering in the space as well. So that's another great resource for anyone that's joining this call today that may want to leverage. Even if you're a small organization and you just want to start somewhere, I think having those conversations with some of my colleagues in TELUS Health is also very worthwhile.
If I may add to that, I think from the Mental Health Commission's perspective, we launched with CSA the very first psychological health and safety standard in the world, and it has been replicated now in many jurisdictions. We have many tools free available on our website for people to access, and you can look at the 13 psychosocial factors and really look at what makes sense for your organization. There's also training we offer. It's called The Working Mind. There's other training that other organizations offer as well. And it really looks at destigmatizing mental illness, thinking about how to create psychologically safe workplaces, and works on the same continuum, which has 4 sections that Diane referred to earlier. And it allows you to identify on any given point or on every given day how you're doing today. So moving from green to yellow, yellow to orange, or God forbid, to red and back. So it really helps you develop a language that you're able to express with your colleagues, with your family, about where you're at on a given day. So there are many tools. Some are free of charge. Please do access those. Accessing training is also a very good way to start the journey for a very small or medium-sized enterprise.
Thank you, Janet and Michelle. I'll stay with you, Michelle. A bit touching on what you just spoke about with regard to barriers with access to care, quality mental health care. Do you think mental health apps and online resources have helped bridge some of these access gaps, certainly in the last 2 years with the rise of virtual care and those sorts of things?
It is definitely a great tool in the toolkit that we have. And if there are silver linings to this pandemic, certainly the rapid deployment of virtual care and application of e-mental health approaches is a silver lining. Now we need to hardwire that in the way we offer. We also need to realize that virtual care is not for everyone. So we need to balance that into our service offering. But in terms of access, for youth, for many of us, it is really a great way to access services and access the right services at the right time. We had been talking about this issue for about 10 years with our partners internationally here in Canada. And in the span of 2 years, I think we've made more progress. So it's definitely part of the solution, how we transform service provision. But we need to also realize that for many, it is not the best way to access services. So thank you.
Thank you. We have only a couple of minutes left. So for our last question, I'm going to pose it to the three of you to each provide an answer. From your perspective, what is the single most impactful thing an employer could do to improve the mental health of their employees?
Want me to jump in?
Sure.
Okay. I think from an employer's perspective, I would say expand how you assess the state of mental health at your organization by embracing, and Michelle just reminded me, which was great, all the great resources his organization brings to the market, but also he mentioned the 13 psychosocial risk factors. And so that's actually a really great way that is low cost or no cost actually for people to start to understand better what the risk is within their organization. And by knowing what pockets of your people are struggling and why they're struggling, and offering a system of support becomes easier when you start to identify those things. So I think it's important to do that. And I think access is probably another thing that, from an employer's perspective, like giving our team members access to appropriate care when they need it, because access is an issue everywhere. And so we want to provide as much access as we can. And we know that that's a pretty significant issue across the country. So I think that would be the other big thing, is trying to create a network of support and ensuring that people have access.
Janet, I'm going to jump on what you said actually during your talk, which ABT, always be talking. And I know you're doing this constantly, just talking about opportunities, creating a safe space, allowing others to be vulnerable. So teaching leaders how to lead from that perspective, reassuring constantly about confidentiality, because you can have an EAP program, the best EAP in the world, but if people don't believe that it's going to be kept confidential, you have to keep reinforcing that, giving team members real tools to support themselves and their teammates. And you have to, the way for it to be stored in your brain, in your hippocampus, to have deep meaning, you have to say it over and over and over again. So ABT.
And I think, just to build on what Janet and Diane have indicated, the next step is really considering that to create a psychologically safe workplace, you also need to consider workloads, flexibility in scheduling, because people may have different personal obligations, and you want them to be able to do their work, but also meet their schedules. So you need to keep an eye on those elements as well as you're managing the teams. But you also need to be able to develop some common language. And Janet talked about culture. Diane just referred again to always talking. Developing common language that people are comfortable exchanging. I mean, you want a workplace where it is absolutely normal to say you're not yourself today, and be able to work with your colleagues and not put anyone at risk. So I think that's the goal, and that's where you should, that's what you should be aiming for.
Just to jump on both what Janet and Michelle just said, the idea of actually writing down rules of engagement for your team. And it can feel a little silly, be kind and assume a positive intention. These should be just sort of baseline behaviors. But I think having them in a manner that is shared with the whole team, that we hold each other up to that level, and make sure that as a new team member comes in, that they're aware this is how we engage from an email perspective, from a team building perspective, from a self-care perspective, how we communicate. Sometimes having it written there just gives it a little more power. And you can say, are you living to that level yourself, but also encouraging everyone on your team to live to that level. So I think being explicit sometimes really does send a message home.
Thank you so much. Thank you everyone for your questions. That does conclude our Q&A session. Back to you, Vicki.
Thank you, speakers. It's really great to see how employers can continue to make a difference in the overall well-being of their employees.